I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and peri-menopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. Have you seen the videos on Instagram and TikTok where people are talking about peptides and the peptide discussion as part of longevity? And you wonder, what in the hell's a peptide? Today, you're getting that information. I've just finished interviewing Dr. Elizabeth Yurth, and this is her expertise. And we had a really interesting conversation. So if you've ever been curious about peptides, you want to know how to use them yourself. You want to know who to get to help you use them yourself. You want to know which ones to take. And even if you aren't yet taking a GLP-1 agonist, that's probably one of the most let's say notorious peptides that we talk about today is the so-called weight loss drugs of semaglutide and tirzepatide and soon to be retatrutide. So we are having that conversation today, me and Dr. Elizabeth Yurth. She is the co-founder and chief medical officer of the Boulder Longevity Institute, where she's been providing tomorrow's medicine today to her clients since 2006. Dr. Yurth obtained her medical degree from the University of Southern California Keck School of Medicine, completed her residency at the University of California, Irvine, and her fellowship in sports and spine medicine from Stanford affiliated Sports Orthopedics and Rehabilitation in Palo Alto, California. Along with her 30 years as a practicing orthopedist specializing in sport and spine medicine, Dr. Yurth has made it her mission to learn and share the latest scientific research on how to truly heal the body at the cellular level. She is fellowship trained in anti-aging, regenerative, and cellular medicine and has completed 500 plus hours of CME training focused on longevity, nutrition, epigenetics, bioidentical hormone replacement therapy, regenerative peptide treatments, and regenerative orthopedic procedures. Dr. Yurth continues to serve as a thought leader in cellular medicine, speaking at longevity events across the world, and teaching others through her position as founding faculty member for the SEEDS Scientific Research and Performance Institute, which leads the way in connecting the latest research to clinical practice. Okay, if you want to know about what peptides to take for weight loss, listen in. If you want to know about which peptides to take for dementia prevention, listen in. If you want to hear about what peptides and hormone replacement therapy do together, listen in. If you're concerned about bone health, bone density, you're osteopenic or osteoporotic, tune in. Dr. Yurth delivers the goods for us. This was such a pleasure to have this conversation. I learned a ton. At one point I said to her, hold on, just stop talking for a second. I got to write my stuff down. And then I'm like, wait a minute, it's recording. I could do that again later. Great conversation. The peptide discussion is certainly something that will revolutionize, is in the process of revolutionizing what it means to be healthy as we age. This is Not Your Mother's Menopause podcast. I'm Dr. Fiona Lovely. Thanks for listening in. I hope you enjoyed this conversation as much as I enjoyed being a part of it. Now, Dr. Elizabeth Yurth. This is the Not Your Mother's Menopause podcast. I'm Dr. Fiona Lovely, and today I'm joined with somebody who I hope to gain a lot of knowledge from, Dr. Elizabeth Yurth, regenerative medicine, anti-aging medicine, cellular medicine, and peptide expert. Dr. Yurth, welcome to the show.
Thank you, Fiona. Thank you so much for having me on.
Oh, it's my pleasure. I really have wanted to have this conversation for a really long time about peptides because they're literally everywhere right now, whether it's
Certainly.
right? The Instagram feed, like everybody's talking about them.
Yeah.
And I asked my Hack Your Age Menno bestie, Zora Benamu, who was the person to ask to have the conversation on the show about peptides. And she said, without hesitation, Dr. Elizabeth Yurth. So let's have that conversation.
Yeah, let's talk.
Thanks for coming. So, what do we need to know? What are peptides? Why is everyone talking about them? What do you know about them? Please share.
Yeah, I think peptides are all the rage right now, right? And we'll talk about maybe you should be careful because peptides are absolutely amazing. You could do so much with them, but you can't ever forget that they're sort of the icing on the cake. You know, that there's a lot of basics you have to cover first. But what is a peptide? Peptides are basically short chains of amino acids. So think about a protein is a bunch of amino acids, but it's more than 50. A peptide is the same thing, except it's less than 50. And it can be 2 or 3 amino acids, like a lysine and a glycine put together. So very tiny. And they have these very important, but very specific signaling behaviors in our body. So whereas a hormone can have kind of a lot of wide-reaching effects, one of the things that makes peptides so nice and actually quite safe is that they're pretty specific in their mechanisms. So you know how drugs, you go, okay, well, yes, this drug's designed to treat my hypertension, but maybe it's going to affect this and this and this and this. Peptides tend to work, and they're a hammer they're going to pound on the nail. And so that's really nice because we can be specific with our treatments with them. And the outlying effects that we're creating are very minimized. So you see much less side effects than you do with pretty much any drug or even any hormone. So I think that that's really what makes them so advantageous. The most well-known peptide is insulin. So you forget insulin is just a peptide. So our body, we eat glucose. Our body produces insulin. Insulin tells glucose to go into our cells and all is well. So very specific mechanism. Without it, we would die, but it has a very specific mechanism of action. And there's a whole bunch of peptides that our body makes. So a lot of the peptides we'll talk about today are peptides that our body makes. They're not some wild thing that was developed out in the creative world. They are just the same thing that our body makes, just like hormones, right? When we're replacing hormones, we're trying to use bioidentical hormones that are the same as my body makes. The same thing's true. I'm going to use peptides that are identical to the peptides my body makes. And I think those are the most important ones to talk about and to know about because our body endogenously does things for a reason, and it makes these peptides for a reason. And just like all of your hormones decline as you age, so do your peptides. And so we have to be thinking about replacing those if we want to stay healthy.
Okay, so it's supplementation of something that is naturally there. I love that.
Right.
Right then, listeners, it's spring. The days are getting longer. And if you're anything like me, you're feeling that little nudge to shake off the winter cobwebs. And just like we might be tackling the clutter at home and washing walls and doing what my grandmother would have called spring cleaning, it's a brilliant time to think about a bit of spring cleaning for our bodies too. Now, hands up, who of you has a whole shelf dedicated to various supplements? Me too. Well, these days, I've simplified things brilliantly with AG1. It's my little daily habit, and honestly, it helps me feel so much more energized as I embrace these brighter mornings. It's just one simple drink to support your digestion, your energy levels, and even our skin from the inside out. And because we're all busy bees, especially as we get out and about more in this lovely spring weather, The AG1 travel packs are an absolute godsend for staying consistent on those weekend getaways or busy work days. Now, when it comes to our health, we want something we can really trust, and that's why I choose AG1. With science-backed ingredients and real benefits I can feel, AG1 makes it easy to support overall wellness every day, and that's why I've been partnering with AG1 for so long. AG1 is offering new subscribers a free $76 gift when you sign up. You'll get a welcome kit, a bottle of D3K2, and 5 free travel packs in your first box. So make sure to check out drinkag1.com/Fiona Lovely to get this offer. That's drinkag1.com/Fiona Lovely to start your spring on a healthier note. I'm delighted to have AG1 as a sponsor of the podcast. Remember, it's a foundational nutrition supplement, and I drink my AG1 every day to support my immune health. It's all part of feeling our best during this fabulous next chapter. Menopause skin. Nobody's favorite part of the transition at midlife we call peri-menopause and menopause. If you're noticing fine lines, wrinkles, or sagging skin, maybe more texture during your menopause, I have some really exciting news for you. Menopause can deplete your skin's collagen, speeding up the aging. But here's the news. Vitale Skincare has built its entire line on the power of GHK-Cu copper peptides, a proven ingredient that signals your skin's stem cells to produce new and healthy collagen. My personal favorite, Vitale's Restorative Skin Cell Serum. I love how it rejuvenates and restores my skin from within, revealing a firmer, more radiant glow. Want to experience this transformation for yourself? Head to vitaliskincare.com and use the code LOVELY at checkout for 20% off. That's vitaliskincare.com, VITALI skin, SKINCARE.com, code LOVELY. Because with Vitale, youthful, vibrant skin is just a step away at any age. So before we go into those topics, tell me, please, how did you find yourself the peptide expert?
So, I've been in this functional medicine, longevity world probably longer than most. I actually got into it about 23, 24 years ago. So it was really, I remember going to the American Academy of Anti-Aging Medicine, and it was, 250 people in the room, and now it's 5,000 people in the room. Mm-hmm. So I kind of got interested in the way I got interested in it was from my orthopedic background. I would just feel much like I was kind of patching people together, but not really healing people, right? We kind of get their knee a little better, but then they'd come back with their knee and bad again. I'd stick more steroids in it, and then we get it a little bit better and put more steroids in it, and then eventually replace it. And I started to look at how can I use functional nutrition or hormones. And then I found out, wow, I could actually just fix somebody's back pain sometimes with hormones. So I went back and retrained in anti-aging, longevity medicine, got a fellowship, and then went on and trained in epigenetic medicine. And then, was really happy doing that. And then started to realize the same thing. I'm like, wow, there's still so many things I feel like I can't touch that aren't, we're still lacking. So I was at an American Academy of Anti-Aging Medicine conference, and I heard a physician speak who was really an expert in peptides, Dr. William Seeds. And it was like, okay, this guy knows what he's talking about, and went and learned and trained with him and became faculty with him and continued to learn and train about peptides. So, and they're changing, they're life changing. They're amazing tools that can really advance the things we're doing.
That's amazing. Dr. Seeds I've heard of as well. I just enrolled in his intro program. So I'll see you in there. If you're faculty, I'll see you in there. So we have these on board. They decline with age. Mm-hmm. It's one of the tools that you can use to help support, as you said, very individual things. So is it a matter of, okay, it's I need a little bit of cellular support, let's say with NAD, and then I need a little bit of ligament support, and I need a little, does it work like muscles? I need to build muscle mass. Does it work like that?
So let's talk about, where we're going to focus, because you're going to focus on the things that have the biggest bang, right? So and then we can get down to things that have very much more specific utilizations. And remember, not all peptides are endogenous. So there now are also peptides that people have synthetically come up with to fix certain things. There's a lot of drugs that are peptides now. There's a lot of cancer therapies that are peptides now. So they're not all things that we make, but I think those are the first ones for you guys to know about and learn about. I apologize. I'm not sure what's going on with my camera, so I'll have to ignore it. But so always remember, hormones are still the foundation. I don't think you can go magically use all your peptides and avoid hormones. I still think that you need to optimize estrogen, testosterone, progesterone in men and women. I think that those need to be foundationally. The thyroid needs to be optimized. Cortisol levels need to be optimized. We really can't ignore that our hormones are declining. They're a big player. So I really want to caution people just to jump on the peptide bandwagon, because I see that a lot, and really make sure that your baseline stuff is all good, right? Nutrition and sleep and light exposure. But if we look at the peptides that our body makes that have such huge value, the first thing that is really important is that our growth hormone levels decline, right? So just like all of your other hormone levels decline, our growth hormone levels decline. So growth hormone is produced by our pituitary, and it exits out and it tells the liver to make something called IGF, insulin-like growth factor. So you can actually measure your IGF levels. And an optimal IGF level for longevity is somewhere between about probably 170 and 190. And you can measure those levels, and most of us are going to be low, just like most of us are going to have low estrogens or low testosterone at my age, right? So that tells me my growth hormone has declined. Remember when we're young, why do we heal so well, right? Like a kid breaks their arm, it's better in a month. I break my arm, it takes 2 years to get better, right?
Yeah.
So why is that? Well, growth hormone is a big player there. Growth hormone is also really important for our immune systems. So there's growth hormone receptors on all of our immune cells. There's growth hormone receptors for helping our brain. So the growth hormone is really very, very, very necessary. The problem with taking growth hormone, because that's hormone, is that the body's not designed to be flooded all the time with growth hormone. It is very specific in how it produces it and when. It produces it primarily at night. It comes in surges. We don't want super high levels. So if you think back to the old bodybuilders, remember how they all looked like kind of this weird bellies that would protrude out? And you could see the muscle, but it was these bellies that were protruding out, and kind of that turtle belly look. And why did they all have that? They were taking growth hormone. And one of the things growth hormone does is it causes your organs to get bigger. So what was making their bellies stick out, because you could see all the muscles still, was actually these enlarged spleen and liver. Now you can imagine that's not very healthy.
No.
So a much better way to more replicate the way our body makes growth hormone is to use what we call growth hormone secretagogues. And those are peptides that tell our pituitary to both make and then release more growth hormone. And it will basically work with our own physiology. It'll say, okay, yeah, this is how much I need. This is how much she needs to be healthy, better, repair, which is going to differ, but the body's going to self-regulate a little bit by giving the message to the pituitary. So we can use, so growth hormone releasing hormones are things like CJC, tesamorelin. So again, those tell the pituitary, release, make a little more growth hormone. And then you can use ipamorelin to release more. So think about one is filling the gas tank and one is stepping on the gas pedal. Ideally, both work synergistically. So usually we'll use a combination of either CJC with ipamorelin or tesamorelin with ipamorelin. Now you can use them separately, but that tends to be the most effective. And you take them usually in the evening, although sometimes we'll twice a day dose them. Like if we're trying to build muscle, we'll do it after workouts a little bit when we want a little growth hormone surge. But we're not going to be bathing the body in growth hormone high levels all the time. So we're not going to see the side effects. We're not going to see edema or the organ enlargement. So we're not going to see all these bad side effects. We get these nice physiologic increased levels of growth hormone. And what that's going to do is I'm just going to repair a little better. I'm going to sleep a little bit better. Growth hormone raises at night. So by doing these growth hormone secretagogues at night, I sleep much deeper. So my deep sleep is improved. I wake up feeling refreshed. That's when I repair. So if I worked out that day, that's when I'm going to repair things. So I'm going to encourage that repair. So I think that falls into, well, all my hormones are declining. So is my growth hormone. How do I fix the growth hormone? The peptide secretagogues are the best way to do that. So that kind of goes top of my list. There's also some very interesting data on just growth hormone's effect on mitochondria health, and we know that mitochondria are really at the basis of almost all disease. So I think that those kind of fall into a very, just baseline, just like replacing your estrogen, testosterone, progesterone. Let's replace the growth hormone, but let's do it with peptide secretagogues.
Okay.
Now, the other big organ that stops doing what it's supposed to do as we get older is our thymus gland. So remember when we're babies, it's this giant gland in our chest. So if you do an x-ray of a baby, it's like this mass in their chest. Like, wow, what's that? And it's the thymus gland. And what the thymus gland is doing is it's educating the immune system. So the body's producing all these white blood cells, and the thymus gland educates those cells and says, okay, attack that virus, attack that thing, but don't attack her. So that's one of the things that regulates autoimmune disease. So you don't really get as much autoimmune disease when you look at babies and people like that. That happens as we age more, right? The thymus gland grows until about puberty. At puberty, it starts shrinking. By the time you're old like me, it's this little fatty nub. It's not doing anything anymore. So people are trying to replace thymus glands. All the big anti-aging people are trying to, how can we transplant thymus glands? The French are eating sweetbreads. That's thymus gland. But the most effective way is to give back what the thymus gland is not there to do. So the thymus gland makes thymic peptides. And the two most important ones it makes are thymosin alpha 1. And thymosin alpha 1 is a key regulator of our immune system. It's, again, what tells me attack that cancer, but don't attack her own liver. Attack that virus, but don't attack her own brain. So if you think about as thymic peptides drop, I'm going to be much more prone to autoimmune disease. So now if my immune system gets stirred up by something like COVID, it promotes my white cells go haywire, but they don't know what to do. They attack the virus, but they also start attacking me. And so you start seeing, these autoimmune diseases appear after some of these viral diseases. So there's a lot of autoimmune diseases that get triggered by viruses, and that's because we don't have the guys teaching us. So think about it, I have a whole bunch of 16-year-olds I've thrown into the army with guns, but nobody's telling them what to do. That's what
Yes.
happens with our immune systems as we age. So if I give back thymus alpha 1, then I can actually educate my white cells what to do so they attack appropriately. So really improves immune function. This peptide is so powerful, it is a drug in other countries. It's called Zadaxin. It is an approved drug, widely used in cancer chemotherapies, widely used in viral therapies. Here it's not available. So it's very sad, right? But you could go to India and get Zadaxin, but here, not approved, hard to get. So we get it compounded. We can get it compounded, and it's used as a little subcutaneous injection. But again, this drug's been well tested. They're like, oh, well,
Yeah.
peptides have not been tested. This is a drug that has been well tested. It's gone through ample testing. It's got approval in other countries. Why is it not available here? Who knows? So that's kind of big on my list too. The other thing the thymus gland makes is what's called thymosin beta 4. Now, some people, out there talk about TB500. TB500 isn't really a real name of a peptide. It's kind of got its name from this old horse peptide that was used, but thymosin beta 4 is the real name of the peptide. And thymosin beta 4 is our repair peptide that our thymus gland makes. So if I'm injured or I need to help grow new tissue, like hair, my hair gets damaged, something like that, then I can use thymosin beta 4. It creates more angiogenesis, so I get more blood vessel flow to the area. It recruits stem cells to the area. So thymosin beta 4 is, again, if ever I'm attacked, I'm going to have to fight the attack, but I also going to have to be able to repair what the attack has done. And that's where thymosin beta 4 comes in. So it's a really important repair peptide. You can use it to help grow hair. You can use it to help heal from a musculoskeletal injury. You can use it for cognitive function. So it's a really important piece. And so what I do, again, when I'm thinking about all this, and we'll talk about this a little bit more as we close, but, is think about cycling these things. Like maybe I don't have to stay on them all the time. That gets outrageously expensive and difficult to be doing all these injections. So I can cycle them at least, right? So at least I'm getting at least part of my time here, for maybe 6 weeks, 4 times a year, I'm still getting this thymic peptides into the mix. And then if I'm injured, I use a little bit more. Or if I have a virus, I'm going to use a little bit more. So we can really kind of target these things when we need them. We don't have to be constantly taking them. Great world, perfect world. It might be nice to be constantly taking them. It's kind of unrealistic for most of us. Thymosin beta 4 has a caveat. You have to be a little more careful with it because it causes angiogenesis. Anything that causes angiogenesis could, if you have cancer, potentially upregulate cancer growth, right? So we're a little bit more careful with that one. Thymosin alpha 1 not. It can be used in cancer. It can actually be helpful in cancer, especially when people are going through chemotherapy and things like that. That's where it's most widely used, like in India, is when people are going through chemotherapy.
Okay. So you're actually, this is the argument for you have to work with somebody who knows what they're doing when it comes to the peptides. Because if you're just
Yes,
chucking
right,
it in a syringe and guessing it, you could potentially be causing yourself more issues.
right, exactly. And you have to know when to use them, right? And what is the proper dosing for what you're treating? And I'll throw in that I know peptides are widely available from all sorts of research chemical sites. You guys can buy them from there. I would say the problem is when you test those, a lot of them have contaminants in it. Yes, they might contain the peptide. A lot of them have contaminants in it. We have our own pharmacy who's tested a lot of these, and a lot of them have contaminants. So you have to be careful. So we only work with compounding pharmacies that are FDA approved that actually have the capability of giving us product that we know is clean, sterile, and there's been a lot of problems with that. The other big problem is people taking their, oh, I'll just mix and I see doctors selling this syringes full of 5 different peptides. You can't take a bunch of peptides and mix them together because these are small amino acid chains. What's going to happen? This amino acid may get attracted to this one. Now I've completed made a whole new peptide. So you can't mix my thymosin alpha 1 and my thymosin beta 4 and my growth hormone secretagogues. You can't mix them all together. You need to remember these are separate injections. They need to be done separately and timed sometimes differently too. So these are all little nuances that really helps to really work with an expert in doing this. Um,
Yeah. And who has the expertise to do that? So,
Well, I think you really need to find doctors who are trained, who have peptide certifications, right? Who are trained in peptides. And there's lots of people now who are doing peptide certifications. Dr. C's SSRP is doing it. New BioAge does a great peptide certification. So I think that getting the education or hard. It's hard to find doctors who really are knowledgeable in this. But I think number one, you talk to them and you say, hey, where did you get educated on your peptides, right? Was it through the internet? Was it Instagram? Was it because you heard BPC is just a great thing? So I think you really have to talk to your doctor and say, so you're using peptides in your practice. Where did you learn about them? Because I can tell you a lot of doctors just jumped on the bandwagon. And I will tell you, I see all the time doctors honestly selling a syringe mixed with 5 peptides, and that's your like longevity syringe, and it's ridiculous. And they're charging $3,000 a syringe, and it's ridiculous. So
wow.
I think you really do want to be careful and
Yes.
to talk to your physician and your provider and say, okay, tell me where you've learned this, and self-study can go a long way, but if they said, okay, yeah, I've read 8 books, I've, watched every course that New BioAge put out, then those people are going to be more valid, but you need to check because there's a
Yes.
lot of doctors who are hopping on this bandwagon.
Well, and I'm wondering who's got it within scope. Is it naturopaths? Is it MDs? Is it like who? Is it just
I
specialist
think it can
MDs?
be any of those, right? I think there's naturopaths who are great at peptides. I think there's chiropractors who are great at peptides. I think there's physicians who are great at peptides. So I think that it just has to be somebody who's really well trained. There's health coaches who are great at peptides. They can't prescribe them.
Yeah.
So if you look at like chiropractors and health coaches, they can't prescribe them, but they can.
Yeah.
I know a great health coach who knows tons about peptides. He can't prescribe them, but he works with a physician who then can prescribe them for him, right?
Yes.
So we do that. If there's a lot of chiropractors who are super
Yeah.
knowledgeable, and they have a physician just help them with prescriptions on stuff.
Yeah, and it's the same thing for us. So in the chiropractic scope, there's no, we can't do any injectables, which is fine. And you can take some of these peptides. This is what we should talk about next is how they're delivered, because we have mentioned that a couple of times, but let's just have a quick chat about that. But it's not within my scope to do it, even though I could do the oral delivery. It's just the injectable. So is one preferable over the other? What have you seen?
So in general, most peptides are done as subcutaneous injections, but they're not something you have to administer, right? The patient administers it themselves. It's a tiny little, pinch a little skin, just like giving yourself a Coumadin injection if you have clotting disorders, or a hormone injection if you're going through infertility treatments. So you could train a patient to do them themselves. So it's not like you have to administer it, right? So you just train the patient, but they do need to be done mostly as a subcutaneous injection. That's the reason, is because these are very small, these chains of amino acids, right? If you digest them, what happens? They just turn into a bunch of amino acids. They're not the peptide anymore. Now, there are some that have been well established to actually stay intact through the GI tract. One of those is body protective compound, or BPC. So
157.
BPC 157
Yeah.
is actually made by our gastric juices. So it's made by our gut. So
Okay.
BPC 157 is made by our gut, and it's very interesting. It both repairs the gut ongoing when there's damage to the gut, but it also recognizes when there's damage elsewhere, and it can leave the gut and go help me heal my torn rotator cuff or my knee pain, right? So it is, but it actually does work, particularly for the gut. It works very well taken orally. I will say it works better for the gut orally than it does for joints. For joints, it does work a little bit better subcutaneously. So not going to the gut where a lot of it probably gets reabsorbed, you'll get more bang for your buck by just getting it straight into my bloodstream, doing it subcutaneously. So usually for joints, I'll
Yep.
use it sub-Q. But for gut pathology, any of you who are taking anti-inflammatory drugs, this is the studies on using BPC along with an anti-inflammatory drug, you get none of the gastritis. The gut, if you look at people who are taking NSAIDs like ibuprofen all the time, if you do biopsies of their gut, almost all of them have some changes to the gut lining. They have some irritation in the gut lining. But if you give them BPC along with that, that doesn't occur. It's that protective to the gut. So remember, our gut is so vital to everything else, right? We know that now. The gut
Mm-hmm.
being healthy is important to our immune health, our cognitive health, our heart health, everything. And so BPC is such, to me, again, you fall that into our body makes it. It declines when we age. We need a lot of it when we suffer injuries or illnesses. So let's put that back into the system periodically, or using it if I'm on anti-inflammatory drugs, or if I have an ulcer, or I have ulcerative colitis or Crohn's disease, or if I am taking anti-inflammatories regularly, that I would definitely be putting those people on oral BPC. And oral BPC actually can just be bought as a supplement. It doesn't even need a prescription. There's a product called Peptides, which is a combination of BPC and another peptide called KPV, which work synergistically together to really reduce inflammation in the gut. So this product, Peptides, Guttides, which you can get online, is amazing for healing gut. But when I look at joints, I want to get a little bit more just straight into my system. And interestingly, anecdotal evidence shows that like I have a bad shoulder, I'm going to inject it actually in the skin close to my shoulder. Mm, the studies show it's going to work no matter where you inject it, but there seems to be some anecdotal evidence from people who have used it for a long time that injecting it close to the site of injury seems to be best. If you have a knee, pinch a little skin by the knee. It doesn't have to be into the joint. It's just in the skin around the joint. And that BPC promotes a lot of healing. Again, a lot of the same things. So use combination BPC and thymosin beta 4, you can actually really, because one of them is going to bring stem cells to the area, increase angiogenesis. So one of them is going to improve collagen repair. So they work really nicely synergistically together for repair of things like joints. Kind of considered what we call the Wolverine stack. Uh,
Ah,
you
yes,
know,
I've heard this
yeah,
terminology.
yeah. So
Yes.
out in the kind of the world here, okay, but I did the Wolverine stack and I healed my rotator cuff really fast, or post surgery. So that's a great post surgery regimen, is to use BPC and thymosin beta 4.
Yes.
Well, I will say BPC again, it works orally. It does work for joints orally, just not as well. And it is one that's tested to show, and probably because it's designed to be in the gastric tract, right? So it
Yeah.
works pretk well orally. So there are a few peptides that are available orally, but I will tell you most of them you're going to be doing as a subcutaneous injection. It's easy though. I mean, I do 5 or 6 a day. A
Yeah.
tiny little piece of skin, and inject it, and you can hardly feel
I can only imagine the kit you carry if that's the number of injections you're doing on a daily basis, right? All of a sudden, syringes are selling out across America. What's happening? Everybody's got diabetes. No, it's not like that.
Yeah, it's funny when my kids was I have 5 kids. When my youngest was in high school, he just went off to college this year. But his high school, he's like, "Mom, can you put your syringes away?" Because you know,
I can only imagine. Okay, let's first of all, you read my mind. I was just about to ask you for joint repair. Do you inject right into the area that there's the problem, or do you still do the sub Q in the belly?
So
Like,
yeah, it works both ways.
okay,
Anecdotally, when I have an injury, and maybe it's placebo effect, but I can tell you it seems to work a little bit better injected close to the joint. I've been nursing this shoulder injury for a while. I'm
yeah,
injecting it close to the joint. Actually, you can see a little bruise.
yes,
So for joint repair, BPC, thymosin beta 4, kind of your go-tos. But it does, like, let's say you have a bunch of joints that bother you. You have osteoarthritis. You
Mhm.
have my knee hurts, my shoulder hurts, my back hurts. And then just inject it into your belly, into your butt. Just go sub-Q to get the systemic effects.
Okay, very good. So is it a matter of, let's say, we'll just use the joint, the shoulder joint. You just keep injecting on a daily basis until that joint is better, Or what if it's 6 months down the road? Do you just keep doing it or do you
So
stop?
typically, so again, we talked about thymosin beta 4 being maybe too much angiogenesis. Maybe we should be a little careful with it. BPC you could take ongoing every single day.
Okay.
Zero downsides to it. It's homeostatic. It's never going to create too much growth. So typically, what I'll do with people is I'll kind of maybe do a 12-week course, right? And then maybe maybe I'll stop the thymosin before, keep them on the BPC, but maybe decline the frequency to make their life a little easier. Go to like a 3 time a week dose, something like
Okay.
that, right?
Okay.
And sometimes just maintain that. I mean, I take BPC relatively consistently. Uh, because my joints are just crappy, and so I take BPC on a relatively consistent basis. So, but I'm not doing it every day. I'm doing it a couple times a week just to kind of help maintain. Again, just like we talked about the things that are declining in our body, let's at least try and keep them. Maybe not where I was when I was 18, but if I can keep them at least at a reasonable level for healing, I'm going to still do better. But thymosin beta
Yes.
4, I'll usually do 12 weeks on, and then I'll take a little break from it, and then I may hit it again.
Okay. Okay. Fascinating. So everybody's talking about GLP-1 agonists, which is a peptide, correct?
Right, right, correct. It's a peptide. People forget that,
Please.
right?
Yeah, teach us about that, please.
So this is glucagon-like peptide. So that's what GLP stands for. And it sits in the GLP receptors, which are everywhere, not just on your gut. But the biggest way they're working for weight loss is actually not their gut, so it's part of it. They do make you full faster because they slow down digestion, hence the constipation side effect of them. But their big way that they help with weight loss is they actually change a set point in the brain. Some great data. Those people I have patients like this, right? They're like, doctor, honestly, I eat 2 pieces of chicken a day. It's all they eat, and they're 300 pounds. And as a doctor, you'd roll your eyes and go, yeah, right. But they did a great study where they put people like that, and they put them in the hospital, and they put them on cameras, and they only fed them certain times a day, this very rigid diet. They had them on camera, so they knew they weren't cheating food. And there was a group of people who lost no weight. So there definitely is some of us who are designed to be survivors, survive the zombie apocalypse. If there's no food around, there's a genetic group that's going to survive, right?
Yeah.
And so it's
Oh, is
great for the
that what it
zombie.
is?
Yeah, so it's great for the zombie apocalypse,
I was
right? But
gonna
it's not
say.
so great for the rest of life. So it's really
Sure.
hard for that group to lose weight. It's
Yeah.
really some genetic bias to be hold on to fat. So the GLP-1s actually change things at a brain level to change that thermostatic set point, to change where the body's comfortable. See, this point where the body's like, okay, this is it. This is what I want to be. This is perfect for me. We can change that through some of the work on the hypothalamus. So it's very interesting that even if you don't change your eating habits, you can still lose weight on GLP-1 agonists. So I love them for weight loss. They have gotten a very bad rap, right? Because
Yes.
people are like dying of constipation and people are losing muscle and you have Ozempic face. And
Hmm.
let me tell you that the problem is because of the rampant and poor use of these. It's not
Agreed.
the drugs
Yeah.
because used appropriately, they do not cause severe constipation. You have to work along with your patients, making sure they're eating fiber and things like that. The
Mhm.
drugs themselves do not cause muscle loss. Actually, I was doing a podcast just yesterday, and I said that, and I could tell the podcast host didn't believe the word I said. But they do not cause muscle loss. These came out many years ago, liraglutide many years ago, and they actually were designed to help diabetics put back on muscle because muscle diabetics have a hard time making muscle. They were designed to help but diabetics put on muscle. So because there's GLP-1 receptors on our muscle, they actually help build muscle. But
Wow.
the reason people lose muscle is because you don't eat. You're
Yeah.
not hungry.
Yeah.
And if you eat, preferentially, you tend to snack on something maybe a little bit more carbohydrate laden because a big steak doesn't sound good anymore,
Hmm.
right? So you're like, oh, I
Hmm.
just eat a couple of crackers. And so you're not eating protein anymore. You will lose muscle. I don't care what you do. So when they look at feeding adequate protein, meaning 1 gram per pound of lean body mass, then those people did not lose muscle on the GLP-1 agonists. So they are not causing muscle loss. In fact, you can grow muscle on them if you feed enough. You can lose fat and grow muscle if you feed enough protein. So you have to really educate people protein
Hmm.
first because you're going to fill up fast, right? So
Yep.
your protein has to be your preferential thing, eating small amounts of it through the day. But you've got to
Hmm.
make sure that protein count stays up, their macronutrients stay up. Ozempic face occurs because you lose fat in your face. So it's
Yeah.
one of the downsides, right? I mean, when you lose fat, you lose it in your face too. That's why heavier people look younger, right? They have faces full of fat. That's why we're taking fat grafts and putting them into faces. So losing fat in your face is a downside when you get thinner. So you have to kind of decide: do I want a bigger butt, a bigger face? I have to kind of that's that balance. There's always a happy medium there, right? These drugs are so vital. And the other thing that people forget, I use GLP-1s in my practice way more than for weight loss. GLP-1 receptor agonists may be, to me, one of the best longevity tools we have because
Say
there are
more.
GLP receptors on our immune cells, on our brain, on our heart. We have a cardiologist in my practice, Dr. Hussein. He uses them all the time for patients with congestive heart failure because they improve cardiac function. They're in
Really?
phase 3 trials for dementia, for cognitive decline, and are very promising for treating people who are suffering cognitive impairments. So they're very preventative to the brain. And you don't have to use them at a high dose. You find a dose that the people are no longer losing weight, that they have an appetite, that food isn't, looks fun to them again. And
Yeah.
that's the dose. So you kind of dose it up until, that's the dose where they start getting side effects, back it a little down from there. You want to go as high as dose as you can with zero side effects of weight loss, with zero side effects of nausea, or zero side effects of food aversions. And once you
Yes.
get there, keep them on that low dose. And you can do it like once a week, but ongoing. I take a GLP-1 agonist because my mom died from dementia, and I'm not going there. And I am not
Yeah.
going there.
No.
So I take a GLP-1 agonist for its cognitive benefits. I have a lot of my patients with cardiac disease on them. I have, my patients who have muscle impairments. I help them with the GLP-1 agonist. Immune impairments, autoimmune disease. These are great. Osteoarthritis. There's some really good data on the GLP-1 agonist in osteoarthritis, and it makes sense.
Hmm.
This isn't actually an immune disease, osteoarthritis. It's not a wear and tear disease. So if I can modulate the immune system, which I can do very nicely with GLP-1s with very few side effects, if any, by using a low dose. So guys, really please try and shut off the negative press about these drugs.
Yeah.
Use it at a
Yeah.
low dose. They're incredibly beneficial as a peptide.
Yes.
Hugely beneficial. I think if we over time we're going to find that both their ability to control metabolism, but also all these other benefits, they're going to be sort of our go-to choice as a longevity drug.
Yes. Yes. Thank you for all of that. And the thing about interviewing somebody that's as interesting as you are is that I want to can I press pause? I gotta write down a bunch of stuff, and then I'm thinking about it, and I'm certainly a processor, and so I can't wait to listen to this conversation back when we're done because you've just said a whole lot in there, but I think I want to go over a couple of things. My mother also passed of dementia, so I am the same way as you.
Yeah.
I'm like,
It's like the
whatever
worst
I
thing to
can.
watch, right?
It's
It's just
terrible.
incredibly hard to watch.
It's terrible.
Like,
And
you lose them long before you ever lose them, and then it's just dealing
absolutely.
with the suffering for everybody around them.
Yeah, and you're grieving them and they're still
Right.
alive, and there's
It's
just all
horrible.
these. Yeah, it's a terrible thing. And we know that the dementia known as Alzheimer's is preferential to women by
Right.
quite a way. So we can be looking at these things at our midlife and say, okay, this is not the menopause conversation is not just about HRT, but are there other things that you can do? And of course, HRT is very, very
Right.
helpful.
Very important, right? Estrogen's
Yes,
super important in preventing dementia, right?
super.
I'm sure your mom did not take estrogen. My mom did not take estrogen, right? It
She
just
was
was not,
taken
yeah.
off it. It
And my
still
mom was
makes
never
me
even
angry.
offered it, right? It's
Ugh.
like, yeah.
Doesn't that make you just mad as hell?
Yeah,
Makes
and
me
the
mad as
stopping
hell.
it kills me. It's like, okay, why do
Yeah.
we stop hormones in women?
What are we doing?
It's like, oh, you're too old now. We want you to die. It's just ridiculous.
Yes, yes. So when I counsel my own patients about the GLP-1 agonists, we have the conversation about Manjaro in particular, sorry, tirzepatide, I should
Hmm.
say,
Right,
which is the dual agonist. I
right.
understand that
GLP, GIP, right?
yes, and then the triple agonist is on its way. Is it approved yet in the US?
It's not to market yet. We were
Got
getting
it.
it compounded for a little while, but then they stopped being able to do it. It's called
Okay.
retatrutide, right?
Yes, yes. And I think it is will be
That's going to be
anyways.
the replacement of everything, right?
Yes, and I what I say to my patients is literally being overweight at this time because of the advancements that we have with the peptides and the medications is going to be your choice. It is no longer going to be about the prison of carrying extra weight, right? And all of the things that go along with that. But it's being prescribed in such a way by the general practitioners that these massive doses that totally
Right.
flatten people's appetite, and
Yeah.
then they get
And
the
they feel
nausea.
miserable and yeah.
Yes, yes. So it's way too high a dose. You're not telling your patients that they need to drink the water because nobody drinks
Yeah.
enough water.
Or
Maybe
eat
you and
enough
I do.
fiber.
Yes, and
Right.
eat enough fiber. And then, of course, when you've got such a flattened appetite, the only thing you do is you force in calories, and that's the
Right.
shitty foods that you shouldn't be eating,
Right.
right?
Yeah, you're kind of attracted. If I don't feel like eating, I'm gonna grab like a crackers, crackers, bread,
Yes,
something like that that's just easy and maybe brain satiating, right? I don't look at a
exactly.
hamburger or a steak and go, "Ooh, that looks really good to me," right? I
No.
just don't, So
So say again what you did about find the place where you have the symptoms and then back off the dose and stay there.
right. So some people you don't you have to keep a really really low dose of some because they will still have food aversion even at a relatively small dose. So basically you want to dose it up until so if I'm bringing somebody off of it who's been on weight loss, that's easier because I can say, okay, just now start backing off. When you want to eat again and your weight is stable, that's the thing is that when you get that dose, it keeps the weight nice and stable too. They don't get any rebound. So basically, I said, and that's the dose we're going to keep you at because probably a little bit more is better, but we don't want any of the side effects. So basically, it's just as soon as you start backing that dose down. If I'm starting somebody on it, I'll just start at a really low dose and I'll have them go up every week by a small amount, like zero point 0.1 or 10 units, every week. And I'll go, okay, as soon as you feel anything like your stomach, your nausea, you look at food and you're like, oh, I just don't feel like eating, go back to the week before, and that's where you're going to stay.
Okay. If you're anything like me, moving through midlife means bringing a few nagging issues, especially around digestion. Maybe it's bloating after meals, new food sensitivities, or just that sense that your gut isn't as strong or resilient as it used to be. On this podcast, we talk a lot about midlife things like hormones and managing stress, but symptoms like fatigue, brain fog, and immune flare ups often trace back to one place: your gut lining. Science shows that many common digestive issues stem from a compromised gut barrier, also known as intestinal hyperpermeability. When those tight junctions between cells loosen, unwanted food particles slip through, triggering inflammation and immune stress. That's where the trouble begins. That's why I want to introduce you to Ultimate GI Repair by Level Up Health. This isn't just another probiotic, it's advanced, natural gut healing at its finest. It's designed to restore gut integrity right at the source. What makes it so unique is its peptide powered gut support, a blend of 4 purified, clinically dosed peptides. The first is BPC 157 for deep tissue repair, Larazotide to reinforce tight junctions, KPV tripeptide to calm inflammation and modulate immunity, and GHKCU to support matrix remodeling and systemic healing. This is true peptide synergy, and it works really well. It doesn't stop there. Ultimate GI Repair also includes zinc L-carnosine to stabilize mucosal surfaces, Tributrin, a bioavailable form of butyric acid to fuel intestinal cells, and buffered sodium bicarbonate to protect peptides from stomach acid and enhance absorption. Whether you're recovering from stress or travel or just want long-term digestive support, this formula is comprehensive, hypoallergenic, and third-party verified. Ready to give your gut the advanced support it deserves? Visit leveluphealth.com and use the code LOVELY at checkout to save 15% site-wise. Again, that's LVLUP code LOVELY. Tell us again about the cardioprotection.
So there's some really nice studies on improving cardiac output with GLP-1 agonists. And it's because there is GLP-1 receptors on cardiac myocytes, so on the cardiac muscle cells. So basically, it improves contractility of the heart. So when somebody who has a poor ejection fraction because they had congestive heart failure, they had a heart attack, things like that, you can actually bring that back up using the GLP-1 agonist. So really, really beneficial there. And then when you look at atherosclerotic disease, less research along that lines, but we know that when you get strict metabolic control, that you lower. Remember, atherosclerotic disease, you can blame lipids all you want, but it's really oxidative stress that causes the lipids to ever be a problem. So we know that we can lower oxidative stress markers. So we can lower oxidized LDLs with using the GLP-1 agonist because oxidative stress is so linked to poor metabolic control. It's funny, I was listening to Eric Verdin, who's one of the lead scientists in aging, and somebody was asking him, well, what is going to be the magic anti-aging drug? And he said, well, it's really going to be something that works on getting strict metabolic control. Because he said everything, all the pathways we've investigated, it all comes back to strict metabolic control, getting the cell in the perfect redox, the right reductive oxidative stress. So it's the mitochondria working most efficiently. And that's, I think, why GLP-1s are going to come into play there. So that's where the GLP-1s are going to stop that oxidative stress. They balance that oxidative stress. If you take tons of antioxidants, you actually lower oxidative stress too much. That's a bad thing. We need a little bit of oxidative stress. That's actually really important. So the reductive oxidative stress needs to be completely balanced, and the GLP-1s seem to be most effective for that. That's probably where their benefit is in helping with atherosclerotic disease. But when you look at its improvement on things like ejection fraction for any people who have had a heart attack and are suffering with, their heart output is not good, we know that we can significantly improve that.
Wow. Other thing that I think we should talk about with the GLP-1s is I'm just so surprised at how rampant poor information is about it. And it's keeping people who could benefit greatly from it
off of it.
Yeah.
I think the problem is what the bad press sells, right?
Yes.
It's like as soon as you see this article, like, 8 people died of, from Ozempic, you're like, oh my God. And you start reading that, right?
Yes.
When you just read 8 people's metabolic health was improved with Ozempic. So bad press, unfortunately, is what attracts us. It's why the news is horrific to watch. That's what we're attracted to, the Twitter feud between Elon and Trump. I mean, those are things we're attracted to watching. And so the problem is that's what's going to get out there to people. And all the scary stuff is just, and we're very easily scared. So I think that
Yeah.
sensible people aren't getting heard.
Mm-hmm.
And that rhetoric gets fed and fed and fed and fed to people. And so it's very hard to turn off that noise and listen to the educated people. Because now I will tell you, a lot of doctors, every day I listen to some doctors saying bad information about this too.
Yes.
Even the thyroid cancer stuff. So that we actually don't think the GLP-1 receptors are, so there was a black box warning on thyroid cancer. Well, that's because mice have thyroid, have GLP-1 receptors on their thyroid. We actually don't. So they're trying to get that black box warning removed, but for now it's like, it caused thyroid cancer, which is not true either. So I think it's people like you spreading the word. It's people like me spreading the word. We have to get educated people out there talking. But people scroll through their Instagram posts and like, oh, look, 10 more people died from Ozempic.
Ozempic, yeah. Well, and I think something else that needs to be addressed is that we love to shame people for carrying extra weight. We love to do it. The number of things I've heard come back from my patients when I've sent a letter off to their doctor saying this patient is an excellent candidate for a GLP-1 agonist. Can we please prescribe? And I hear things like,
they just need to eat better, right?
She just needs to eat less. She needs to get exercising. That's so expensive. Why would you want that? I'm like, wait a second. You don't do that with blood pressure medication. What the hell are you doing that? Right? Like, we don't talk about insulin.
You sat there and looked at the person who had high blood pressure and go, you just need to eat better.
And judge them.
You're going to, of course, tell them to do that, but at the same time, you're going to freaking treat their blood pressure.
Yes.
And obesity is by far more risky than the hypertension. In fact, probably causing the hypertension, right?
Exactly.
So you're I get that all the time too, and you get that criticism from people. This is just a cheat. People just nobody. And like I said, there are people, number one, who can't lose weight by diet and exercise. And number two, we should be treating them while they're losing weight with diet and exercise.
Absolutely. And if it was a calories in, calories out problem, We would
Nobody
have
would be fat.
solved that. Exactly.
It's right.
We
Nobody would
would
be
have
fat.
solved that.
It's
And
yeah.
if you had any doubt left in your mind, probably just watching how your own patients did with this particular peptide
Oh
changed
yeah,
your
I have
mind real
patients who
fast.
I've tried to have lose weight for a long ass time. They've been in my practice for 10 years. I'm like, I have tried everything, right? And nothing worked. And the GLP-1 agonists work.
I could cry for them.
It's remarkable. Now,
Yes.
sometimes you have to dose them up. Sometimes you have to add things into it. They're not always the magic bullet. So that's where,
Yeah.
sometimes we add cagrinolitide, we add sort of another peptide into the mix, or sometimes you have to use things that do raise metabolism a little bit along with it. So there's always people who don't respond the way you think. So it's not everybody this is the perfect answer for, but usually when you dose them to an appropriate level and sometimes maybe add a little bit of combination stuff into it, most people you can get to do well.
I love it. So, can you use the peptides for bone health?
So bone health is interesting, right? Because hormones are so incredibly dependent there. The estrogens and testosterone and progesterones are by far the most important thing for bone.
Okay.
And you do have peptides, synthetic peptide. So teriparatide, which is Timlos or Forteo, right? So we hate the bisphosphonates. Bisphosphonates create bad bone. They create bone that fractures easily. Some like Fosmax drugs, those are bisphosphonates. Prolia, those create abnormal bone. So yes, your bone density gets better, but it's weaker bone. But things like Timlos and Forteo, those are actually peptide drugs. And they're this peptide called teriparatide. And they work very well as bone anabolics. And they're actually very safe. The problem is they're super expensive to get. For a while, we were able to get teriparatide compounded at a much better price, but not so much anymore. But I think they should be much more used for bone density than they are right now. Now, I will also mention that you can use a peptide hormone called oxytocin. So, all of you guys have heard of oxytocin that we make when we're in love, right? It's our love hormone. So, when you're in love with somebody, you produce all this oxytocin, it makes you feel good. We produce oxytocin, that's what stimulates labor. We produce oxytocin when we're lactating. So, actually, that's why we fall in love instantly with our baby, and our baby falls in love instantly with us. So, oxytocin is a really powerful peptide hormone. And it has a very big play also in bone density. I love to use
Wow.
oxytocin for a couple of reasons. Number one, it just makes people feel happy. You can actually take two people who hate each other, give them both oxytocin, and they'll like each other. It's that powerful. So you can use
Wow.
oxytocin also for pain control. You can use oxytocin for anxiety. So you can use it like as a nasal spray and help people with anxiety or who have social, like don't like to be out in people. Like they just don't like people. It'll make people be able to talk easier and get along. So I love oxytocin, but it has some very interesting effects for both muscle and bone. So we know that it's anabolic to muscle, so you can use it post exercise to help build muscle. And when the studies have been done on oxytocin, they found that women who have highest levels of oxytocin have the highest bone mineral densities. And that was even when estrogen was depleted. In both mice
Really?
and rabbit models, in ovaries removed, in mice and rabbit models, if they replaced oxytocin, they could keep them from losing bone. So oxytocin was actually a big player in bone density. So some exploration going now on using oxytocin for bone density replacement. Now I still think you want your estrogen and progesterone and testosterone. I think those are going to be much more powerful. But can we add a little oxytocin into the mix? So we'll do that. We'll use a little oxytocin along with it in women that are still losing bone when their hormones are optimized, or women who can't take hormones for some reason, right? Can we use a little bit of oxytocin because it has all these other added benefits too? It's neuroprotective, it's anti-anxiety effects. It's a really fun peptide hormone to try because it just kind of
Yes.
makes you feel happier.
So if you supplement with oxytocin, does it prevent your own oxytocin from happening?
No, because you're not using such massive amounts that it's going to suppress your own production.
Okay.
So, so no, it does not suppress your own production, but it does make you like your desire to have sex, things like that can be better. So you can use it actually to increase sex drive in women, a little puff and their sex drive will be improved. Again, you can use it anabolically to help build muscle. So it's a really underutilized peptide
Yeah,
hormone.
I'd say. hug your kids, hug your spouse, hug
Right,
your
exactly,
friends.
exactly. That's what I think. Try and make your own more, right? And
Yes.
which unfortunately, right, we're also isolated anymore, right? COVID, particularly, like why people die, they know, they weren't seeing people, they weren't social.
Yeah.
That's why social connection is so critical.
So critical.
It's so critical to us, and we still, so many of us are, not going to offices, and I'm fortunate that I work in an office with a lot of people.
Yeah. Me
But
too.
how many people are stuck in their houses all day and aren't seeing people all day, and so they're not even getting this sort of stimulus that tells us to produce these really beneficial things.
Well, and we know that social isolation is one of those health risk factors that's higher than even
It's
some
huge.
some things. Yeah.
It by far surpasses all this other cool stuff we talk about.
Hmm.
If you can't, number one, get out in nature, correct your circadian rhythm with light. So get out and get morning light, get afternoon light, get evening light. If you can't do that, this other stuff doesn't work. Our mitochondria are dependent on life. I mean, quantum biology has showed us that light, energy, water, structured water, those are all things that are really critical to our mitochondrial function. So you've got to be out in nature. You have to be exposed to light, not your UV lights all day, right? You have to be able to turn light off at night. So you have to be able to be in darkness at night. You have to put on blue block glasses at, after dawn, after dusk. Those are so critical. So
Yeah.
top of my list when I'm talking about longevity to people is social connection and purpose. And
Mm.
then light, dark, metabolism, making sure that your circadian rhythm is corrected. Those go way above any of the stuff we're talking about.
Yeah. I love that because that's stuff you can do yourself.
So
It's
you're
not
right. It
like,
costs nothing, right? It
yeah,
costs
you
nothing.
don't
Go
need
hug a
anybody.
tree. It costs nothing.
Yes, exactly. Okay, let's come back to bone health. So I have a number of patients in the clinic right now who have osteoporosis that are not going for treatment because
Yeah.
they've heard these horrible things about Fosamax, etc. And oh, my friend had to pay $10,000 for that shot, or
Yeah.
these
Yeah.
all this. So there's a lot of fear around it. And
Yeah.
so what I say to them is at least talk to your GP about getting some hormone replacement
Right.
therapy.
Hormones.
And here's the thing I always get pushed back at me is my doctor says I'm too old for hormones.
Yeah. Ugh.
So let's talk about that, please. Is that a thing?
So no, it's not a thing. Now, definitely, the earlier you get going on hormones, when your hormones start dropping, the more protected they are, particularly for cardiovascular. So big Stanford studies show that hormones were most protective for cardiovascular health when started earlier than later.
Okay.
But they did not have an effect later. They were still helpful, just not as helpful. So it is important to start hormones as early as your hormones start dropping. So I will say that's important, but it is never too late to start hormones. Like why? Like that makes zero sense, right? At least I can stop somebody from continuing to deteriorate and hopefully help them start rebuilding their bone and their brain and their heart with proper hormone treatment, even if they're 90 years old. So there's no age that we've not seen benefit from hormone replacement.
Okay.
And again, the Women's Health Initiative study scared everybody to death. Hormones done appropriately, and utilized the correct way do not cause cancer. They are much more protective. Remember, you talk about your patients with osteoporosis. If you fall and break a hip, you have over the next 5 years a 25% chance of dying. I mean, it's that high. 25% of people who break their hip will die. 50% will end up with reduced function. This is something you should be really scared of, right? Really scared of is breaking your hip instead of cancer,
Yep.
because cancer is much less likely than breaking your hip. We can
Put it
pretend
that
we
way.
can we can very easily protect you from breaking your hip by having adequate hormones on board and making sure your bone density stays high. And everybody needs to check their bone density, because that's the other thing you see. You probably see it in your practice, right? As doctors don't even check bone densities anymore. I don't even see people getting tested. So go get a DEXA scan. You can self order it, right? Go get a DEXA scan. Know what your bone density is. If it is low, you need to treat it. I have women who literally never had a bone density tested. We get them tested. They've lost 37%, 38% of their bone, right? By the time, and nobody tested them. And
Yeah.
we've got to try and build those people back up.
Yeah, we do. I mean, having the conversation about frailty and preventing frailty, I mean, that was a big factor for I know my mom's own progression with her
Right.
dementia,
Yeah, my mom
etc.
really, I mean, she had the dementia, but she died because she fractured her pelvis. She fell and fractured her pelvis. And then it was
Yes.
just like,
It was that thing. Yeah. I have so many more questions for you, Dr. Yurth, but I think what we'll do is we should just do a second episode sometime in the next year. And I just want to thank you so much for delivering this information.
well, thank you
There's
for putting the information out there and spreading it.
Yeah, it really. It's my pleasure and it's my honor to get to sit with someone like you and just learn. And so thank you for teaching me so that I can share it with my people. And thank you for teaching all of us that are listening to this show. And I know there will be questions. So, where can people find out more about you and the work that you're doing, please?
So we have a clinic, Bodo Longevity Institute. We see people from all over the world, so we can see people virtually. We're licensed in most states. So Bodo Longevity. So if you go to www.bodolongevity.com, and you can fill out new patient information there, and somebody will call you and walk you through everything we offer here between hormones, peptides, stem cells, whatever it might be that you're interested in. So that's our sort of physical clinic. But again, we see people virtually. We've got patients in London and Canada and New Zealand, so we see people everywhere. If you want to just learn, we actually have a whole academy that we actually try and work scientifically teaching people, trying to teach people to be their own doctors in a sense, right? So you actually know how to read your own labs, what is out there and available. So you can go to bli.academy. That's our Human Optimization Academy. We just did a Q&A this morning. These Q&As are amazing. People ask amazing questions. And there's both practitioners, but just people who want to learn in there. So it's really fun. And the stuff we talk about is just incredible. So bli.academy is our learning arm. Follow me at Dr. Yurth and at Bodo Longevity Institute, because I try and put up a lot of information both on YouTube, on my YouTube channel, Bodo Longevity Institute YouTube channel, and our Facebook page, and then Instagram. So please follow us there, because I try and put a lot of good information out there, trying to dispel like the myths about GLP-1s, trying to teach a little bit more about peptides. So it's just from a more scientific perspective. And then spread the word, guys. You got to be the ones who spread the word about this.
Yeah, absolutely. I belong to the academy and I love it. There's such great
Thank you.
information there.
Yeah, it's fun, isn't it? I mean, have you tuned on the Q&As? Like,
I have it, and I saw the email come in for today, and I'm like, wait a minute, isn't that the time we're talking?
Yeah, an hour earlier. Yeah, no, but the Q&As are like, holy cow! The questions people ask, you're like, geez, people are really smart in this academy, and so they ask me these questions that are really challenging.
I love it. I've learned a ton from it already. So thank you for putting such high quality information on the academy. I really appreciate it.
Well, thank you for being a part of it and sharing it.
Oh, absolutely. I have a final question I ask all my guests, and I'm going to ask this one to you now. It goes like this. Knowing what you know now, what would you tell your younger self?
I think the biggest thing I would tell myself is that that it's so important to I think I spent a lot of my years going, I'll sleep when I'm dead. A whole lot of years, right?
Mm-hmm.
Of studying and pushing, and I exercise like a fiend, and I don't think it did me a lot of good. I think that I need to go back and tell myself, you know what? It's much more important to prioritize your sleep in your relationships. You don't have to be so out there all the time pushing. You don't have to be exercising, every single day without taking a break. Because I think I did damage, and I think I suffered injuries, and I think that some of that was permanent. I think some of the stuff I did was more permanent. And I was, in that generation of everybody's got to be super skinny and and so I did a lot of harm. So I would go back and prioritize that sleep, relaxation, my relationships with people would go way at the top. I mean, with my babies, I took 2 weeks off work. I mean, it was that pushed to just, I can't take time off work. That's a bad thing, right? So fortunately, I have incredible parents who helped me raise my kids. But I would go back and and rethink that whole piece and try and live life in a much more peaceful fashion.
That's great advice. And I know I'm part of that generation too. So
yeah.
Isn't it interesting just how many of our colleagues, the other women that we went to professional school with, that have autoimmune disease?
Yeah.
Isn't that fascinating?
It is, right? We did not do ourselves. And I think partly being a woman in, like, you as a chiropractor is more of a men's world, right? My world is much more of a men's world. You really, like, you were chastised if you took time off to have a baby. You were, it's like, oh my God, the stupid girls have to have, so you were going to push through no matter what, right?
No matter what.
Too bad.
I did a job interview once, and I had the clinic owner ask me, he said, so are you planning on having babies? Because and he went on to say, I'm sick and tired of covering for my female colleagues when their kids are sick. And I thought, I wonder what your wife would say if she knew you were saying stupid shit like that. Anyways, okay, Dr. Elizabeth Yurth, thank you for dispensing wisdom today.
Thank you, Dr. Lovely.
My pleasure.
All right.
The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.